Hi again, Dr. Robert Strang, Chief Medical Officer of Health. So today we're announcing two new cases of COVID-19, bringing us to a total of 14. So we have 5 confirmed cases and 9 cases that are presumptive tested here in our local lab. All of those cases, the age ranges are between people in their 30s to 70s. They're in communities across the province. They've all been related to travel or close contact with a known case. We did have one person, one of our cases identified a few days ago, was hospitalized last night. We understand that that individual's condition is stable, that from the very beginning, from 911 being called to EHS to all the way through to the COVID unit at the HI site, that healthcare workers were appropriately protected with the right infection control and personal protective measures. And that's important that our healthcare workers are stepping up at an increased risk of exposure, but we do have appropriate protocols in place to protect them, and those were all followed. There are a couple events that have happened in the last announcements in the last few days. So the first was, we know now that one of our cases, that there's been potential exposure to COVID-19 at a basketball tournament, March 5th to 7th, to both the Halifax Grammar Gymnasium and the gymnasium at the Homburg Center as part of on St. Mary's campus. So there's a notification has gone out from the health authority. It's still considered a low-risk exposure. Anybody who would have been in direct contact would have already been notified by public health, but it's necessary to inform the public, anybody who was at either of those gymnasiums during that time period at the basketball tournament may have been exposed to COVID-19. We're asking them to monitor their health carefully. Somebody who's part of the Dalhousie University community has been identified as a presumptive case of COVID-19. Public health is working, so any close or direct contacts with that case have or will be shortly notified by public health. But Dalhousie wanted to make sure that the community in general knew about this, but also understood that while they may be made aware, if they have not been connected or directly contacted by public health, they have had no exposure and are not at any increased risk. Both of those situations are inevitable over time as we get more cases. And we fully expect that we're going to get more cases and likely going to get community spread within Nova Scotia. That's why it's important that everything we keep repeating every day, the importance of personal protective measures, the importance of social distancing, of our closing down places where large numbers of people can gather. Those are what we have to minimize the spread of this disease, to minimize the impacts. I just need to clarify a couple of pieces. I explained the social distancing and self-isolation yesterday. As I was explaining the social distancing, I inadvertently used the example of going to a playground. We're asking everybody to distance ourselves from each other physically, the social distancing. But we want people to be outside and being active, but just doing it in ways that doesn't bring you in close contact with other people. It's unfortunate that we know with kids going to playgrounds, it's hard to keep them apart, and also there's lots of little hands that are going on all sorts of surfaces. So we're not in any way, in fact, we're saying that playgrounds, the people should not be taking their children to playgrounds if they go out and about. Take them for a walk in the park, get in the car, go to the beach, walk on the beach, but playgrounds are off limits at this point in time. They're a higher risk setting. The other piece that came up about people who are in self-isolation because of travel. They can go out too, as long as they're keeping that distance. So going out, working your yard, sitting on your deck, going for a walk, going for a bike ride, absolutely fine, as long as you're maintaining the social distance. But please, if you're on self-isolation, if you need to get groceries or you need your prescription medication, other essentials, please make arrangements to have somebody else do that. Somebody else maybe in the household who is not on self-isolation because they didn't travel, or if you have a friend or a family. Lots of communities are setting up ways that people who need essentials but can't go out into those public spaces to get them can get support to do that.